Alberta's situation is dire. The head of Alberta Health Services made it clear yesterday. At no other point in the province's history have there been so many patients in intensive care. She said the only reason they're still able to admit people to the ICU is because a certain number are dying of COVID-19 each day. Surgeries, even those desperately needed by our kids, are being cancelled across the province. And I fear that the situation is only going to get worse in the days ahead. But this fourth wave, unlike any before it, has exposed the staffing shortages that we know were already causing problems, that were already creating backlogs long before the COVID cases spiked. Despite the pandemic, the UCP government has pressed forward with attempts to engage in pay cuts, threats of mass firings, and they've continued to undermine the claims from the front lines made by workers. Healthcare workers who saw the capacity challenges facing our hospitals back in June, but whose concerns fell on deaf ears of a government that minimized their calls until it was far too late. All of this has undermined and in some cases absolutely destroyed morale among Alberta nurses. We need mental health supports for these heroes, no question, but we also may need to convince them to stay after all that's happened. Yesterday, the government of Quebec took major steps of their own to address hospital staffing shortages. They introduced sweeping support payments to draw more nurses to the front line of this crisis. Under Quebec's plan, all nurses working full-time in the public system receive a $15,000 bonus. All nurses working part-time who move to full-time hours will also receive that bonus. And nurses who've retired but returned for the duration of the pandemic receive $12,000 bonus. So I'm basically here to say that we effectively need to do the exact same thing here today in Alberta. And so it is absolutely possible to do. In the budget in the spring, the government gave themselves, I can't remember the exact, it was $1.5 or $2 billion flex money to spend in healthcare. We haven't really seen them spend it yet. Frankly, they're saving money, sadly, by all the canceled surgeries that we're seeing right now. So, and even if they weren't saving money, we can't afford not to do this.